You need something to actually ignite a certain type of drive inside of you. It's a self-sustaining passion, self-sustaining fire that basically puts you in a position where if I leave me in any position, I will choose ENT over and over again.
We see about 500 patients per month in the clinic. We operate about 35, so it's very hard to decide which patients we need to operate. So the first priority would go to our cancer patients, because in a cancer patient, time is of the essence. The patients that can afford to be on the waiting list longer is usually the patients with blocked noses, which is more of an uncomfortable thing than a deadly thing. The patients we aim to help through this project has on average been waiting for 2 years to 14 years.
So if you leave this unattended for a prolonged period of time, those adenoids really cause quite significant damage. And that's what we try to prevent, and it causes a type of high blood pressure called pulmonary hypertension that cannot be treated. And once you reach that stage in your life as a child, there's no going back. It just becomes worse and worse with time. What we've embarked on is to actually now remove these tonsils and adenoids, which is actually a very simple procedure. But just by doing that, you actually improve quality of life massively, tremendously. You actually can live a normal life.
This collaboration with Mediclinic definitely does make a difference with our backlog of patients. Here at Grace Hospital, there's a significant backlog of patients requiring elective surgery. And the main reason is because of the lack of theatre time. And the lack of theatre time is contributed to by the shortage of nurses, shortage of other resources within our theatre.
So it's not only because we want to service a sector, but it's just the pure enjoyment that I get from ENT and the patients and the smiles and the gratitude and everything that is associated with ENT patients.